I'm going to stop there, I think, because I think that it also gets a bit tricky, because I think when we talk about enshrining, we want cultural shifts, and of course we want cultural shifts. I'm a teacher. Part of my job is I'm supposed to be teaching cultural shifts around nutrition, obesity, athleticism, right? I coach the hockey team, I teach civics and that kind of stuff too. But that, within that, the culture of downtown Toronto is different than the culture of Northern Ontario, is different than the culture of Quebec. So, no one thinks we shouldn't have preventative measures and pieces in place. But how that gets invested in the funding for that, I think, that could be determined in the 2014 Accord, that there was funds directed and earmarked for preventative systems, places, and best practice models.
And we'll go to Dr. Bennett and then Dr. Wilcox.
In the 2004 Accord, you can't imagine during that negotiation how thrilled we were that Tuesday night we were actually talking about diabetes and falls and all of those things, and that actually there was a section on prevention, promotion, and public health. It actually even said about healthy schools, about HIV/AIDS prevention, about diabetes. It was a beginning. I spent a year negotiating with the provinces and territories on health goals for Canada, which really was about disease prevention and health promotion and social determinants of health. So I think it's possible, but it's also possible for the federal government to lead on things that are even advertising, letting people know around childhood obesity. This may be the first generation of kids who don't live as long as their parents. That the national food strategy that we're putting in place will actually have breakfast programs, but put in place such that the healthy choices are the easy choices in terms of labeling, in terms of all the things that we can do as a regulator. So absolutely, but it still has to be a partnership with the provinces and territories, but I think they're there, and it's just that there's not been a partner at the federal government on any of these files. The minister made an announcement on child obesity, didn't have $1 associated with it.
All right, thank you, Dr. Wilcox.
In terms of health, I think a lot of green policies actually are good for your health. If we create active, livable cities, which is part of what the Greens want, and please look at our platform on cities, it is far the best of any of the parties. Limit our carbon emissions and the rate of traffic-related deaths and maimings. Livable cities such as Copenhagen allow pedestrians and cyclists to commute without fear for their lives. Active transportation enables people to incorporate exercise into their daily life. You no longer need to belong to a gym. You can just cycle to work.
And maybe we could just add on to that.
Sure, if you'd like 30 seconds to respond to what everyone said.
We know when governments invest in transit that people are healthier, that people who take transit walk and get there. We know that obviously if there's every smog days in Ontario have cost up to $1 billion in healthcare costs and absenteeism. So do you want clean air or puffers and respirators for all? So if governments will look at this in its holistic way, that investments in early learning and childcare, we know that's where lots of kids get their nutrition. So I hope that, if there really was a partner at the federal level that got it and could be helpful, but it is
Dr. Bennett. We'll go on to Michael.
Yeah, which is a great segue.
Which is what will happen on May 2nd.
Which is a great segue to the fact that the NDP also we have proposed a urban transit strategy plan. Most G20 countries have a consistent base funding for transit in cities. So we need to make sure that that's a cornerstone of the upcoming platform in policy. And also too, we've sort of not been talking a lot about mental health as well, right? And so we know that a lot of mental health issues have direct connections later to physical health issues. So, and as a teacher, to me, mental health is part of healthcare. And a lot of my students actually do need doctors, not just social workers, for their healthcare. And
thanks, Michael.
And
sorry,
my often have to wait a year after the referrals before they see a professional.
Dr. Wilcox, did you want to add?
I think that's a question.
Okay, another question? There was one over in the middle, I think. There was, I think, blue, orange, and then there was someone up in the corner as well.
Yep. sure.
Yeah.
Hi. So a really big problem that we haven't really talked about yet is wait times. I don't think it's come up yet, especially for diagnostic imaging and MR. So how does each of the parties plan to deal with that problem?
Would you like to start, Dr. Wilcox?
In terms of wait times, I think we've done pretty well with wait times, to be honest. Ontario has. And wait times still for MRI may be 6-8 weeks, but I think wait times are pretty, you know, you could have a cheap response of, oh, we'll buy 100 more MRIs for every small unit, and I don't think that's going to help. So it's got to be within. I mean, I do believe the Greens think we have to live frugally, and I think wait time strategies where you strategize who needs it quickly and you classify whether it's a class 1, 2, 3, or 4 works well. Again, computerization, universal electronic health records so that you're not duplicating. So many people have so much duplication of testing. And I think if you do that sensibly rather than promising you a whole lot of expenditure. I do think that Ontario, we should give credit where credit is due. Ontario has done well to reduce wait times.
Dr. Bennett?
No, I think the wait time fund that was put in place in the 2004 Accord actually, with a sort of wait time czar, actually really did have some positive effects. I think and diagnostics is always the worst because when you're waiting to find out if you've got something, this is interminable in terms of how awful it is for patients and for the physicians or providers. So I think we can do better, but we need operating dollars to run those machines more often, like they do at General Motors. I think that we need 24/7 for the very expensive pieces of equipment. Inpatients could be seen through the middle of the night. I think we just need to get better at it. But again, we need to make sure that the people being referred for these are appropriate. And so the appropriateness of these tests, it's like when we trained there was the Ottawa ankle rules, that without, you know, if you didn't get an x-ray for your ankle unless it was swollen, blue, painful, and you couldn't weight bear, then you explain to the patient they do not need an x-ray unless those things all come together 3 days later. And so by getting clinical guidelines up and online so that patients aren't asking for what they saw on ER or Grey's Anatomy last night, that they actually get what they need, not what they think they want or what they heard over the back fence they need. So by posting clinical guidelines, I think we can also make sure that people are taking charge of what they want. We don't want kids to have CT scans with growing brains.
We'll go on to Michael.
So this might sound a bit repetitive, but I think so, other than the fact that we obviously need to have funds both for capital costs, so the technology we have enough of the pieces, and that it's the most, most up-to-date we have, but we also have to have just operating funds for that as well. And then after that it comes to innovation and change. We've already talked about how, you know, the idea that the hospital has to be the sort of lamp that all the moths go to, right? That's the sort of the magnet for people's healthcare has to shift, because a lot of people end up going to those spaces, getting tests done and taxing the system in a way that doesn't need to happen. So the more that we can use online information and community hubs and a better educated population, then that would reduce the pressure, which would hopefully then in turn reduce some of those wait times.
All right, we had a question from someone down the middle, and unfortunately we only have time for, I think, 2 more questions. So.
So my question is really nitpicky and it's for the Green Party, but I feel like it's relevant because you talked a lot about reducing waste and evidence-based healthcare, and also said more healthcare is not necessarily better. I found this on a website and I just double-checked it on the Vision Green. It's on page 70.2 says to expand proven alternative therapies that are less expensive and invasive, such as acupuncture, chiropractic, and massage. I'm not a medical school student, but I feel very strongly about this. There's no evidence for acupuncture, any systematic, take for example acupuncture, but also chiropractic or massage, any systematic double-blind study or